my great pleasure to introduce to you Constanze Lämmer to speak to us on the care of the infant with PWS. Constance graduated in medicine from Leipzig University and received her doctoral degree in '92 with the emphasis on endocrinology. And after 8 years in internal medicine, she started her qualification as a pediatrician and became a senior physician at the St. Bernward Hospital in Hildesheim in 2005. She's qualified in pediatric endocrinology, diabetology, nutrition, somnology, epidemiology, and she established the Hildesheim program for treating patients with PWS and frequently sees more than 300 patients with PWS. She's a scientific advisor to the PWS Association in Germany and has presented her work at several conferences and done many PWS training programs throughout the world. So thank you, Constance. I'll now hand over to you. Thank you.
So good morning, everybody. I hope you can see my presentation. Yeah, very good. So it's a pleasure for me to give this presentation today about the care of infant with Prader-Willi syndrome. So at first, thanks, Georgina, for the kind introduction. In my presentation, oh, sorry, there's a small problem. In my presentation, I like to cover the following topics. We will shortly have a look at the situation of the infant with Prader-Willi syndrome. Then I will show you our holistic treatment concept, which includes nutrition, physiotherapy, early intervention. We will have a look at the endocrine aspects of the first year of life, orthopedic problems, and maybe we have time to look at some additional health issues. So what is the situation of the infant with Prader-Willi syndrome? Infants with Prader-Willi syndrome are often delivered out of breech presentation. They are often premature and have a low birth weight. So adoption is a big problem. They have breathing problems and feeding problems due to their muscle hypertonia, and they show a failure to thrive. What can be helpful for them? All these supportive possibilities we will discuss during the presentation. For infants with Prader-Willi syndrome, we developed a holistic treatment concept. It includes all these parts of nutritional management first, how to have physical activity, the psychosocial support, and therapy with different hormones. The nutrition plays a very important role in this concept, but nutrition always in Prader-Willi syndrome starts with physiotherapy. So the muscles are not ill in Prader-Willi syndrome, but muscle mass is much smaller than in other infants. So increased muscle tone means increased muscle by physiotherapy. There's also a special feeding training. It's called Castillo Morales. This is very helpful. Parents can learn special feeding techniques. They can learn how to stimulate the baby, take very special feeding positions, and how to use baby bottle teats, for example. So often tube feeding is necessary in addition. We have to educate the parents about practical aspects of nutrition. So infants with Prader-Willi syndrome need about 2/3 of the energy intake compared with a healthy infant of the same age. Feeding ad libitum is mostly not successful, so it's better to feed the infant every 4 hours during the first months. So the weight development will be better. We give weight charge, like for example, like this, to the parents for self-control. Our target is the 10th percentile or the 3rd to 10th percentile of the weight charge. So parents forced to weigh their infant every week and then report this to the growth charge. So energy intake can be adapted in accordance to the weight development. In general, we introduced the meshed food in the same way than another infant, but we have to take the motoric developmental age in account and not the calendaric age. Infants with Prader-Willi syndrome learn to control the head in upright position later, and this is necessary for being able to have meshed food. So we have to educate the family how to organize family meals with an infant with Prader-Willi syndrome. The target is that the infant can take part at the family table. They can start with meshed meals if the infant is able to sit at the table in an upright position. Often parents of children with Prader-Willi syndrome are afraid of the obesity in later life, and that's why they start to reduce unsaturated fatty acids, that mean, for example, the rape oil, when they prepare meshed meals. So the infant not get enough of these important unsaturated fatty acids. They are important for body development, but also for brain development. So we have to ask them to use the proper amount that the infant is need. Chewing, to learn chewing is a good training for learn speaking. So we have to give more and more solid food to learn chew and moving the tongue. The parents were said to give piece of bread instead of cookies, and we avoid sweet drinks because we like to take the chance of conditioning the taste. Physiotherapy, there are different methods all over the world in the countries. The Volta therapy and the Bernward conception are two common therapies. The Volta conception based on neurophysiological principles, it do not need the cooperation of the infant. The Bernward conception support the movement development and has an influence of the whole day. So of course, these both concepts and all the other concepts can be combined. Parents learn, for example, in the Bernward conception, how they can hold, force the baby to hold up themselves on the arms, what is a good position for playing, and for example, how can the infant support to learn crawling. These are only some examples. Parents of infant with Prader-Willi syndrome get very little feedback from their infant in the first months. So they hear no cry, they see only a very little smile. So they need information how to spend time with the baby and how they can stimulate the baby. The early intervention is very important for infant with Prader-Willi syndrome to stimulate senses of the infant. So parents can learn about baby massage, about kangarooing, how to sing and speak with the baby, how to get eye contact, how to stimulate the baby with music or colors. So the parents will become more sensitive to small signals from the baby and changes. And this is a good basis for the parents-infant interaction. Now let's have a look at some endocrine aspects. Nearly all boys show up with crypt orchidism, though an operation is necessary at the end of the first year. In some countries, it's common to make a potential preparation with GnRH. In Germany, we don't do this. Parents often afraid about problems around the anesthesia. So if you follow all the advices on this website, www.orphanet-anesthesia.eu, there should be not a problem. In girls, we often see a labial synechia. We treat this with estrogen self locally. We have to inform the parents that the possible side effect can be a temporary breast growth, so that they are not surprised about this. We see thyroid problems, especially the hypothyroidism. We have to keep in mind this infants with Prader-Willi syndrome more often have central hypothyroidism. So if we check the thyroid function, we have to check TSH and FT4, otherwise we will to overlook this. There are rare cases of central adrenal insufficiency, so we inform parents about this, and in urgent cases, these infants get a treatment with hydrocortisone. In some countries, or in many countries, growth hormone is available for treatment for infants with Prader-Willi syndrome. So we can start from an age of 6 months. In some countries, it started earlier. No growth hormone tests are necessary if Prader-Willi syndrome is genetically confirmed. The target of the therapy is not only to improve to increase the final height, it's more to improve the body composition. And this is a good basis for a better psychomotor development. There are some dose recommendations, and of course, it's necessary to have regular checkups, not only for the endocrine parameters, also for metabolic parameters, and for overall check sleep apnea. We have orthopedic problems in infant with children with Prader-Willi syndromes, and sometimes they start in infancy. So to prevent scoliosis, we should avoid passive sitting. Sitting is allowed when the child reaches this position himself. Crawling should be learned first. We can prevent foot problems by massage, bandage, or use from tapes. We can prevent cranial deformations when we change head and toe position in bed every day. So it sounds very easy, but it's very helpful. We have other additional health issues which we should keep in mind. For example, the high pain threshold. It's necessary to know about this for the parents, because so they can prevent accidents. The infants have a poor thermoregulation. This winter it was very important to be aware of this. The infants have teeth erosion problems, a decreased vomiting and daytime sleepiness. So solutions you can, ideas for solutions you can see on the slide. So if we bring all this knowledge we have to the parents, infant with Prader-Willi syndrome will have a chance to grow, thrive, and develop better. So some informations, more informations, you also can find in these booklets. Sorry, they are only in German and one is in Dutch. For now, I thank you for the attention.
Thank you, Constanze. That was lovely and wonderful timing